This is a patient who one of my colleagues saw this patient initially. Post-trauma, had quite a bit of midfoot arthritis, but also a valgus ankle deformity. So he put a Salto in, and
Why didn't you try to fix any of the
midfoot for me, because he wasn't painful there. Now, I didn't do the primary procedure, but this is what was done, because it was felt by the surgeon that his midfoot deformity was not significant enough or symptomatic enough to address at that time. So the tibial components and a little bit of valgus. So those are all really valid points, Roy. And again, I didn't do the initial procedure, and I think they're all. And I think the point about getting a plantar foot is very important for long term. This guy's 70, and not a real active 70-year-old, but he just had ankle pain. So sometimes it's hard to convince patients. Okay, I'm gonna cut your foot in half. Try to get better alignment. Got to go through a 6 or 12-month healing process for that. So anyway. So you're right. I mean, he was pretty happy with his ankle until it got infected. Okay, so then even more bone loss, even more valgus positioning of the hind foot. So then I inherit this patient because he didn't like the hospital that the current surgeon was going to do this case at. So he came to my clinic. So obviously the infection is now cleared up. He's got a good soft tissue envelope. He's